Hello, and welcome. Today we're diving into a condition that affects the very essence of movement, spinal muscular atrophy, or SMA. This is a genetic disorder that weakens muscles and impacts daily life. We'll explore what causes it, how it affects the body, and what options are available for managing it. Spinal muscular atrophy is primarily caused by a genetic defect. Specifically, it's a mutation in the SEMA1 gene, which stands for survival motor neuron 1. This gene is responsible for producing a protein crucial for the health and function of motor neurons. When the SM1 gene is faulty, the body doesn't produce enough of this essential protein. SMA is inherited in an autosomal recessive pattern, meaning that a child must inherit 2 copies of the defective gene, one from each parent, to develop the condition. If a child inherits only 1 copy, they become a carrier but typically don't show symptoms. The SMN protein, as we mentioned, is vital for the survival of motor neurons. These are the nerve cells in the spinal cord that control muscle movement. When there's a shortage of SMN protein, these motor neurons progressively degenerate and die. As a result, the brain's signals can't reach the muscles effectively, leading to muscle weakness and atrophy, which means the muscles shrink and waste away. The severity of muscle weakness depends on how much functional SMN protein the body can still produce. While the primary impact is on motor neurons, SMN can also secondarily affect other organ systems, especially in severe cases. SMA affects people of all ethnicities and genders. It's estimated to occur in approximate 1 in 10,000 live births. Carrier frequency, meaning the number of people who carry 1 copy of the mutated gene, is significantly higher, estimated at around 1 in 40 to 1 in 60 individuals. This high carrier rate explains why SMA, though relatively rare, still affects a significant number of families globally. Newborn screening programs are increasingly being implemented to identify SMA early, allowing for quicker intervention. The signs and symptoms of SMA vary greatly depending on the type and severity of the condition. Generally, symptoms involve progressive muscle weakness, impacting the ability to crawl, walk, sit, or control head movement. Infants may exhibit a weak cry, difficulty feeding, and problems with breathing. Other symptoms include tremors or twitching of the tongue, scoliosis, curvature of the spine, and contractures, stiffening of the joints. Remember, symptom severity and onset can differ dramatically between individuals. In severe forms, breathing difficulties and respiratory infections are common complications. Diagnosing SA typically involves a combination of clinical evaluation and genetic testing. A neurologist will conduct a physical exam to assess muscle tone, reflexes, and motor skills. If SMA is suspected, a blood test called genetic testing is performed to look for mutations in the SEMA1 gene. Electromyography, or EMG, which measures the electrical activity of muscles, may also be used to evaluate motor neuron function. In some cases, a muscle biopsy may be performed, but this is less common now that genetic testing is readily available and highly accurate. SMA is often classified into different types based on the age of onset and the severity of symptoms. Type 1, also known as Wernicke-Hoffmann disease, is the most severe form, with symptoms appearing in infancy. Type 2 usually presents between 6 and 18 months of age. Children with type 2 can typically sit but can't stand or walk independently. Type 3, or Kugelberg-Willander disease, presents later in childhood or adolescence. Individuals with type 3 can often walk, but may have difficulty with activities like running or climbing stairs. Finally, type 4 is an adult-onset form of SMA, characterized by mild muscle weakness that develops in adulthood. While there's currently no cure for SMA, there have been significant advancements in treatment in recent years. Several FDA-approved therapies aim to increase the production of functional SMN protein. Nusinersen is an antisense oligonucleotide that modifies the splicing of the SEMN2 gene, allowing it to produce more SMN protein. Onisinogene Parvovec, also known as gene therapy, delivers a functional copy of the SEMN1 gene directly to the body. Risdiplam is an oral medication that also increases SMN protein production. Supportive care, including physical therapy, occupational therapy, respiratory support, and nutritional management, is also crucial for maintaining quality of life and addressing specific symptoms. Multidisciplinary care involving specialists like neurologists, pulmonologists, and orthopedists is often necessary. Since SMA is a genetic condition, there is currently no way to directly prevent it from occurring. However, genetic counseling and carrier screening are highly recommended for couples planning to have children, especially if there is a family history of SMA. Carrier screening can identify individuals who carry 1 copy of the mutated SMN1 gene, allowing them to make informed decisions about family planning. Prenatal testing, such as amniocentesis or chorionic villus sampling, can also be performed during pregnancy to determine if the fetus is affected by SMA. Newborn screening programs are increasingly being implemented to detect SMA early, allowing for timely intervention and potentially improving outcomes. The prognosis for individuals with SMA varies depending on the type and severity of the condition. Historically, type 1 SMA was often fatal within the first 2 years of life. However, with the advent of new treatments, the outlook has significantly improved. Individuals with type 2 and type 3 SMA can often live into adulthood, although they may experience significant disability. The goal of treatment is to slow disease progression, improve muscle strength and function, and enhance quality of life. Ongoing research is focused on developing new therapies that can further improve outcomes for individuals with SMA, including gene editing and stem cell therapies. Scientists are also working to better understand the underlying mechanisms of SMA and identify potential targets for future treatments. The future is bright for those living with SMA, thanks to ongoing research and the development of innovative therapies.